Hi, welcome back to our channel. I'm Dwayne, and today we're going to be talking about back pain. I know the last time we touched up on sort of acute disc issues where bending over sort of bothers things in the back. Today we're going to be talking about the back pain that you get when you're standing for a period or you're up on a period. That's going to be more of the stenosis side of things. So stay tuned. So signs of stenosis or sort of lateral foramen stenosis is pain with standing for periods of time or laying flat on your back can create increase in pain. Red flags for these are going to be numbness and tingling in the feet, shooting pain down the back. If you're getting any of those symptoms, follow up with your physician. Okay, so what is stenosis? Stenosis is, there's two types. The first one is central canal stenosis. So your central canal is this hole in your vertebrae where the spinal cord sits. What happens is as we age, our body will start to grow and the bones will grow and shrink the hole that the spinal cord sits in. And what can happen is over periods of time, as that gets smaller, when we move around, the bone will shift and actually touch the spinal cord, and we can get symptoms going down the legs, which can be very painful. The other type of stenosis is the lateral foramen here. Also, as we age, we can start to get that shrinking. But also what can happen is also as we age, the discs can shrink, which can bring those two segments closer together and can make those foramen a little bit smaller there. So also again, right, when that gets closer or smaller, there's less room for play. And that can also be very painful if we end up touching a nerve. So some things to think about with that are positional tolerances, positions we stay in, but also hereditary factors are going to be big. So if you have a family history of stenosis in either regions, you might be at greater risk. So that's something to think about. You know, if your parents or your grandparents had a bunch of back pain and they were diagnosed with stenosis, that would be one reason to go to your doctor and get that checked out if you are dealing with some of these symptoms. So you might be asking why it hurts when you're upright or in that extended lean back position. So this is one of the main reasons is a lot of people stand with an anterior pelvic tilt, which is this direction here, or they'll stand with what's called a sway back posture where their hips will stand like this and they'll kind of lean back and relax without even really knowing it. Now what that does is if you look and watch my lower back in that position, right, it puts me in either this arched position where we get this backwards C curve in an overextended amount, or I'm here and my pelvis shifts forward and I get the same thing moving there. So I bring my back into extension. If you are having problems with that standing for periods of time, one simple solution is to just get a little step, and that will help prevent this overextension, because as I bring my foot up, see how that naturally flattens my lower back? If you're doing something like washing the dishes and you don't have space to put a step, you know, a lot of those places will have a cabinet. You just open the cabinet and there's normally a little bit of a lift and you can rest your foot there. And then, you know, as you get tired from standing on one leg, you can just switch legs. So the first exercise that I like to do is called the prayer stretch. So a couple things: if you have a ball, use the ball because it's going to be a little easier. If you don't have a ball, I'll show you a modification for that. So Nate here, he's sitting and his weight is going to be on through his hands, and then he's going to roll the ball slowly away from him just to feel a tiny bit of a stretch in his lower back. He's going to pause for a couple second count and then slowly roll back in. Okay, so he's going to do a few. and it's very slow. Watch his pacing because it's a slow movement, just to barely feel a little bit of a stretch. I don't want any pain. If you're feeling pain or pain shooting down the lower extremities or your toes start getting tingly, you need to stop this exercise. I normally tell people to do about 20 repetitions multiple times a day as needed to help alleviate the symptoms. Okay, so if you don't have a ball at home, what you're gonna do instead is you're gonna put your hands on your legs there, and then you're gonna put the weight through your hands, and then slowly allow yourself to bend forward using your arms to control the weight. And then he's gonna slowly use his arms to help push him back up. In the same rep scheme, he's gonna go down slow, he's gonna pause for a couple seconds, and then he's gonna come back up. Again, we don't want any pain with this. This exercise is the kneaded chest stretch. So the first variation of this is a single kneaded chest stretch, where Nate's gonna grab the knee, and he's gonna pull it and hold to his chest, okay? Couple things here, he shouldn't feel any pain. Just a light stretch. You might feel a little bit of alleviation from those symptoms if you do get the pain in your back when you're laying flat. So he's gonna hold this for 30 seconds. Again, no pain, just a light stretch. After 30 seconds, he's gonna switch sides. So let's pretend that was 30 seconds. He's gonna slowly bring this leg back down. Then he's gonna switch sides. We're gonna hold this side for 30 seconds. You might notice there's a slight difference in the tension from side to side, and that's completely normal. So that's nothing to worry about. And we're gonna bring this knee down. And then what we're gonna do after that single knee is we're gonna pull both knees to chest and also hold that for 30 seconds. So 30 seconds on one side, 30 seconds on the other side, and then 30 seconds together. This exercise is a march. So it's a little bit harder than it looks, and there's a couple of things leading into it before that I want to talk about. The first thing is making sure you're bracing your core, and the second thing is making sure you're trying to control your lumbar spine and preventing it from going into extension. So what can happen sometimes is if I don't brace and I lift the knee up and I come back down, as I'm coming back down, my back will go into that extended position, and that can aggravate our symptoms. So what we're really working on here is trying to stay as stable as possible. So the first thing you're gonna do here, as you're laying, you're gonna lay in this hook lying position with your knees bent and your feet flat. Then you're going to brace your core and try to put pressure on your lower back. Notice how his pelvis tilts from a slightly extended position into this nice neutral position. He's solid. When I try to put my hand underneath his lower back, I can't slide it under there because his back is flat. Okay, he's braced in his core, and he's gonna try and sustain that, and he's gonna lift the knee. We're gonna lift the knee, we're gonna pause for a couple seconds, then we're gonna slowly go back down, and then we're just gonna alternate. If you feel like you lose the brace and you need to stop and reset, that's completely fine. Stop and reset, because the last thing we want is for you to continue to rock back and forth into and out of extension, because that can aggravate your symptoms. Normally, I recommend about 10 to 15 on each side at a nice slow pace like this. Thanks for watching this video. If you liked it, or you found that it helped, or know somebody that you think this will help, please like, subscribe, send that link to them, because we want to get this out to help as many people as possible. If you do have back pain and it's not the type that we described earlier in this video, and it's more of a pain with flexion or pain with sitting, go back, check out the channel. We have a video for low back where you're bending over and that bothers things, so you can check that video out and hopefully that helps.